I know there are different techniques for treatment of cartilage defects, and one of the most successful treatments that we can have for cartilage is chondrocytes implantation. And I use this technique for over 15 years. So the standard ACI involves two surgical procedures. And to the opposite, the CartiONE technique is only one surgical event. So we do everything in one procedure. So the patient is prepared, and then we take a biopsy, and then after 1 hour, we can have the cells that are ready for an implantation. Most of my patients have a very complex situation, so very often I do different procedures at the same time. When I start with the biopsy, I pass it to cell biologists that work together with me in OR, and then I have 1 hour. So I could, for example, do an ACL reconstruction or an osteotomy or some other procedures that had to be done. So it doesn't really change the normal path of the surgery for my patients. So behind the CartiONE there is a very elegant research, and that supports the philosophy of this technique. So the secret of this technique is that we mix two types of the cells. So the chondrocytes, which are main part of ACI, are mixed with mesenchymal stem cells taken from the bone marrow. So that means that we can have less chondrocytes, but because of they are primary chondrocytes, they have much more power in producing the cartilage matrix, and we use the bone marrow cells that support the chondrocytes in production of matrix. I think that this is a very interesting evolution of the standard ACI, and I really hope we will perform more and more procedures like this, because so far my patients are doing very well, and we are very happy with how it works.